And so it's interesting taking a look at your health and seeing where the sources of destruction come from. And what is helping you. And so we're not an island. Everything affects us, whether we like it to or not, but we can be aware with the help of the Holy Ghost to recognize how we can deal with it and overcome those difficulties. In the name of Jesus Christ. Amen.
Thank you.
Our Father in heaven, we are thankful for this wonderful day and for the opportunity to be able to come to class. We ask you that thy Spirit may be with us and that we'll be able to understand the information and how to apply it. We ask you that we'll be able to be instructed in ways that will allow us to better utilize the information that we have, and that we'll be able to understand how we as nurses can influence the environment and how to improve the lives of others. And these things we say in the name of thy Son, Jesus Christ. Amen.
Thank you so much. That was perfect. Perfect intro.
Joanne, it made me think of the nursing offices downstairs.
Yeah. Yeah. You know, all the construction that they've been doing on the first floor, they're building, they knocked out a wall, they're, putting 2 rooms together anyway. And they have all this plastic up and all this dust flying around. And the workers down there are walking around with masks. And I'm thinking, should we have masks on too? I mean, honestly, wasn't there an asbestos kind of thing where in this building? Anyway, I heard years ago that if you don't disturb it because this building is not new. I mean, it's really old. And I'm just thinking, ooh, I don't know. And then there's been episodes down in nursing hall where instructors have actually been made sick. And actually, Sister Miller had a respiratory thing going on and couldn't take it. And finally, they found mold in her office. And so she had to move out, and then they had to get rid of it. And then they searched all the other offices, and they found mold in a couple of the other offices. So talking about the environment, it really does affect you more than you would even think of. We get so busy in our daily lives, what have I got next? What do I have to do? What do I have to say? Like this, we don't even think about what's around us. And think about, like Alex was talking about with his little kids. I mean, other people have little kids, and like in the book it was talking about pain, with little kids and environmental things that affect pediatrics. And so that's something that you would be thinking about, especially if you're a nurse and you're doing a health assessment in an area, whether you're an occupational nurse and you're doing it there, whether you're, just in a community where, there are all kinds of different housing units in, for instance, well, not just urban areas, because there's a lot of, stuff there, but out in rural areas. How often do those areas get cleaned up? So there's a lot of stuff around us. And so if you're ever in a situation where you're having to do a health assessment, an environmental assessment, you've got to be on your game, and you need to have done your homework and know what you need to look for, because it's all right there under your nose, and we don't even think about it. So, really quickly, we actually have 3 chapters to cover, but I'm in the mood for a debate. I don't know if it's the Hesse or what, but I'm in the mood for a debate. So I would have, let's see, how about these 4 rows against those 3 rows? Okay, that's okay. I just can't divide you guys in half, half people. Anyway, so what topic should we debate?
What are we learning?
You name it.
How ready we are for graduation.
No, it's got to be environmental.
Chapter nurses and occupational health.
You talk about global warming.
If there is such a thing as global warming.
That's what I'm trying to say.
Exactly. No, I'm serious. Okay, we can do that.
Yeah, climate
Climate
change, that's right.
change,
Because
global
it's not
warming.
actually warming.
Okay, these guys are representing the government.
Oh,
Okay,
that means the worst.
Okay, you guys are representing the believers in global warming and in the government. Okay, you've heard things, you've heard things. No, you're
She's
the
changing.
government.
Because the body.
You're the pro, yes, global warming.
I didn't think the government agreed. I think the Democrats and the
All
Republicans
right,
don't
you're
agree.
the Carl Sagans, okay? You know, he's the astrophysicist that says global warming and we're destroying the planet. You guys are like, no, there's no problem, it's just made up. Why it's made up? I'm sure you know, but because I don't. But anyway, okay? So I'll give you guys 1 minute to make your stance, give you guys 1 minute, and then a short rebuttal. Okay? Okay, that's right. Okay, so President Trump of the United States, yeah, he doesn't believe in global warming. In fact, he just got back from a conference that he was the only country that didn't join the pact and recognize global warming. And in fact, he was the only one that said, in fact, when he left, they were still on him. Oh, okay, are you gonna join us on this effort? And he was like, let me think about it, got back to the United States and
No.
a couple days later went, no. So, okay, so he's not for it, but just because he's not for it, does that mean that the country shouldn't be for it? Or shouldn't believe in it? So
Well,
anyway, you've got 1 minute, ready, set, go.
climate change.
Hey, Ryan.
Oh, you want me to say it right now? I thought we had a minute to argue.
Okay. Oh, okay.
Oh, we want, I can
Okay,
argue.
fine. Have 1 minute.
Oh,
Bam, done.
Just let me. Climate change.
Okay, 50 seconds.
our whole argument is I have to look up climate. Whatever.
Yeah, I know. I feel like,
But that's an estimation. And a lot of people say that's an overestimation.
It's up on your
It take more
computer.
than 1,000 years.
But I mean, like, I agree, you know, obviously. Humans, they know they're affected now.
But my beef with it is the money that we're using to fund going green programs or the regulations we put on businesses.
Oh, we already
To
have.
try and go get into.
Alright.
It's increasing our economy, we're limiting our
Alright,
growth
this team,
compared to Russia and China.
okay, this team has 1 minute. They have the floor. Okay, go. So, yeah. So why should we believe in it? Why should we?
Well, see, I looked up this chart.
Okay.
You probably can't see this, but you can see over the years, the average temperature has gone up. So there is evidence that global warming is occurring.
Would you mind writing your sources on the board?
Google.
Don't worry, it's from Wikipedia.
Honestly, there's one from NASA.
Oh.
So the government funded program.
That was something. Carbon dioxide level has increased significantly over the years, specifically from the year 1950 to the present day. It's like a direct line up.
Wow.
Therefore,
That government funded program would agree with the
I will
government. Concur.
quote, scientific evidence for warming of the climate system is unequivocal.
Okay, all right. One more item before we change sides. Anything else you want to add? We're right. So you, NASA charts, anything else that really proves global warming is an issue? That anything has happened with populations, with our environmental, sorry,
The sea level.
the sea level. Ooh, the sea level has gone up how much? Do they know?
8 inches in the last century.
In the last 100 years, 8 inches. All right. Okay. This side's turn. Okay, go.
The debate on climate change is very polarizing. It's very fun to say this stat and that stat. But the truth is, the weather's changing all the time, and the Earth has gone through cycles, and that is not debated. The Earth was an ice age, it is no longer in an ice age, it got warmer. That's gonna happen. But I think the real debate is should the US be front-running the world's efforts on trying to go green when other countries like China and Russia do not spend as much money as we do, and they do not limit their companies, and they do not limit their industrialization. So they grow and they prosper and their economies grow, but America is held back. And so that is why President Trump pulled from the Paris Accord, because we were donating most of all the money and doing all the efforts. We were the only truly large industrial company that was doing any kind of cutbacks, and it limited our growth and it limited our prosperity. It cut jobs, it cut money, and at this point in our country's economical status, I don't think that we can afford to pretend that humans have any kind of effect on the way that the world is functioning, especially a world that was created by a god.
Okay.
Oh,
30 seconds. 30-second rebuttal. Okay, go. What you got?
Well, on his idea of it going up and down the weather, we can see from my chart. It does go up and down, but overall, the trend is that it is going upward.
Okay.
So the hottest temperature, so if we're going off like temperature increasing, the hottest temperature in Arizona in the past 27 years was 1990. So in the past 27 years, it has not passed the highest temperature in Arizona. So, I mean, it's not showing, it's showing that it fluctuates, yeah, but it's still in the past 27 years has not approached or gone above the temperature it was in 1990. And if we're industrializing like we have been, and we've had a major effect on the environment, then it would have increased more than that, but it hasn't.
Okay, all right, yeah.
What's the point of global warming? What are we gonna do to fix that problem and not cause other problems? We were talking about how electric cars, it's more hazardous to try and dispose of the battery for an electric car than it is the exhaust from a regular 4-cylinder, 6-cylinder vehicle. And so you're gonna have some hazardous waste that cannot be reused, that cannot be filtered or recycled,
Okay.
stuck somewhere from so many vehicles, affecting the land.
That's
Whereas
very interesting.
you have some air pollution that you can take care of and minimize.
Plus the chargers on the highways that they're going to be putting up, you know, along these long highways. Where's the money gonna come from to put those up for the electric cars?
Is it worth it and is it cost effective?
Yeah, so there's.
All
Okay, we're not gonna say that.
Solar panels.
All right, so as you guys can see, well, we could just be here all day talking about, you know, environmental things, right? But as nurses, how does that apply to you? So let me just say that historically, how have nurses been able to identify a relationship between the environment, chemical exposures, and their harm? How have they been able to do that? In the past, like 20 years ago, how did they do that?
Just like watching cause and effect.
Okay, cause and effect. And it's actually kind of like what Alex was saying, you know, whoa, they've seen all this illness in their family, they're making an environmental change. Why? Just to see if it has some, you know, effect with where they're living. At first when he says, well, sadly to say, we, instead of saying, you know, when we went to live with our in-laws, I thought he was gonna say, we had to clean up the whole house. I'm just kidding. Anyway, but I mean, you know, to do that, that's a huge, huge effort, you know, that people have come in to remove mold or whatever's there. So that's what the cosmic deck, like you guys were talking about, that's what's happened in the past, but now we have other things. We have companies that come in and kind of look for things, biomonitoring, chemistry, extrapolation by toxicologists, observing signs and symptoms in clients. And actually, you know, when you're, like I said, when you're first assessing clients, what would you ask them on a health assessment, on an environmental assessment? And also talking about occupational, you know, nursing, I'll just drag that into it as well. If someone's having a problem with occupational, they think of the environment as well. You know, where did this person is having this problem, where did they work before here? And is whatever created that problem before, is it still occurring here? And what is it, and do we need to fix it so it doesn't affect other people? So environmental health, you know what, we could just spend so long on that. So if you were to choose an environmental health issue, which is what we just did, you know, the hazard, the effect on the people, interventions that could take place or should take place, and that's if the role of the nurses should play, and you know what the role of the nurses is to reduce or eliminate what's going on. I want you to go to this website right here. It's www.ehso.com. It's one of the best websites that, so let me go up here. EHSO. Compliance, environmental training. I think this is it. Yeah. All right, so right here, this is just a really good website. Just keep this in your portfolio of websites that you can go into. And they are talking about the environment, the health and safety right here. So you can keep going on and going to any of these: animal waste, allergy information, air, indoor quality. What did the book say about indoor quality of the air? Some people think if they go inside, they're safe. Why is that not necessarily true? What do a lot of times basements have a problem with? Radon and mold. Yeah. And you don't even know that it's going on. I had mold in my basement, and they came, you know, I mean, I'd get rid of it. Cost $2,000. Yeah. For what? To get rid of, it was an area about like this. It was by the central air, and I was like, whoa, $2,000 to get rid of that. And my insurance didn't cover it because they said it was, you know, recent or whatever. I don't know. But anyway, they wouldn't cover it. Or maybe it was my deductible. But it was a lot of money. It's something you don't want to deal with. Okay, so what else are you seeing on this website? I mean, you can, it's got anything from ants in the home to allergy to air pollution. It's a really good website. So if you want to just keep that in mind, to go there. Go back. Okay. All right, and then as we were kind of talking about, you know, you hear things all the time in the news about articles, things happening. In fact, the other day, and I know this is kind of a weird thing, phenomena, but, a 1 mile island suddenly appeared off the east coast. Global warming? Could it be global warming?
Sounds like the ocean went down.
Well, I don't know. I don't know.
Oh,
But anyway, because of the currents and everything, and I mean, it's just right off the coast. I don't think it's, I think it's on North Carolina. I think it's over there. Anyway, you can Google that. But people are like, whoa, where did this come from? And they want to go out there and look at it. It's a great place for shells and all this, but I mean, why does that happen? So talking about the environment, and then what does it create? And of course, they tell people not to go out there because of it coming up, the current's really strong. And so, yeah. So that's just something that I heard in talking about the news. Oh. Let me just go back. Okay, let me, ooh. I missed all this. Just a second. Okay, next thing. Oops. All right, so you guys, it's important for you to know what I-Prepare stands for when you're doing a health assessment. And I think that was on your e-prep, so you guys got that, right? You know, I to investigate and talks about where they work, where they come from, what they're doing, what their environment is like right now. Windshield survey, that's pretty non-intrusive. You guys can do that, you've already done it, you know, for your community assessments. But you can do a windshield survey and see certain things, like what? Like what? Factories, you know, pollution from factories. Yeah, lots and lots of fires. I think Utah right now has about 7 huge fires going on, you know, and then, you know, depending on the wind current, where does all that smoke go? You can go to environmental databases, which I just showed you one, we'll go to another one too. There's an environmental health assessment form that you can get and fill out, and it just covers everything. And observing unintended environmental exposures. So what would that be like? Unintended environmental exposures. Okay, so my home teacher came over, this was years ago, was helping kind of pick up one area that I had and with my family and everything, and there were some old tires that were on a ditch bank, and a fire was going, you know, in a big pit, and he threw the tires in the pit.
Oh.
And I'm going, and this is an intelligent man. This is someone who owns his own company. This is someone, you know, I mean, he's, anyway, been to college, got a master, and all that kind of stuff. And I was, what are you doing? You can't do that. Number one, it's against the law. Number two, all these black plumes of smoke came up, like really thick. And I went, oh my gosh, you can't do not. Of course, it was too late to get the 2 tires out that he had thrown in, but, because they were already, you know, really on fire. And the smoke was going up, I mean, like, all the way really high in the sky, and I'm thinking, oh, there's gonna be fire engines coming out here, or whatever. But why don't we burn tires? Have you heard of zinc oxide? That's being released, as well as the wire fibers that's in the tire. Oh my goodness, and sometimes they're very tiny and small, they can get in your lungs if you have any lung problems, or you will if you don't. Yeah, so, I mean, there's all kind of unintended environmental exposures. So let's talk about children. So why do we worry about children? Especially children, why do we worry about them? There's some things that affect children that don't affect adults, and why?
Oh, well, I was gonna say children really don't have much of a choice in their environment. They can't. They're kind of naive to it. They're not gonna know.
Okay, they don't have a choice, they have no idea. Okay, good. What else?
Oh, their immune system just isn't developed.
Good, immune system. And the other thing is how tall are they? They're closer to the ground, so So whatever's on the ground, they might be affected more than we are. Okay? Anything else? Physiologically, yeah.
I was just gonna say, like, they're so small that any chemical or toxin's gonna have a greater effect on them than it would on a larger person.
Yes, yes, excellent. Okay, good. So, this is just some questions that you can think about. We don't have time to go into all of these at all. But, the nurse advocacy role, if you are going into a home for, let's just say, an environmental assessment, and you are seeing certain things that you know would really affect the children, and you don't say anything about it, of course, I know you would, but that might really be affecting them. You know, we talked about the lead earlier, the homes built before 1978, you probably have heard that before as well. Drinking water being a contaminant. How about people that are going up in the mountains and camping? Okay? Little kids are picking up, I just heard this on the news, picking up ticks. And this one little kid, I can't remember what state, but she was like 3 or 4. She got infected. Her parents actually didn't know. And she, you know, got this tick bite and ended up dying because of that. And that was just on the news. And it was like, so make sure you come out of the mountains, you come away from camping or in rural areas, you take a shower right away. You know, you check yourself and check your children. So that's really important. All right, so primary prevention then is the key. Would you say? We've said that in this class many times. If you have used primary prevention, you shouldn't have to use the secondary or tertiary. Nurses can also, these are just generic things, we can shift to e-records to avoid paper, recycle, go fragrance-free. This has really been one, especially in the hospital. And as you work in the environment, this would, you know, affect the workers as well. Fragrance-free, there's many people. I know that there was a nurse that used to work here on staff, and her husband could hardly go to church because sitting in sacrament, he was allergic to like fragrances, and he could hardly go to church because of that. So these are some of the, you know, start a green team. I know you guys will you? I'm just kidding. And then create community. And then if you'll write this down, this is a form that actually you can go through for an environmental health assessment. This is a really good form. It covers anything from waste disposal to using porta potties to child care and pets. So this is a really good site. So everybody get that? Okay. But it's a really good site. It just kind of shows you that form. It's pretty comprehensive. It's put out by the government, I believe. Yeah. Okay, so the DHHS, Department of Health and Human Resources. Okay. All right. So situation. Can I slide read this so I'm not talking? Sorry, Ryan.
A small rural community is located about 150 miles from the nearest tertiary care center. The community comprises less than 500 residents who are primarily Mexican immigrants. Many of the men in the community are employed at the local power plant, which is located at the edge of town. The women work in the grape fields for a few hours a day while managing the household chores in the afternoons. Residents in the community have verbalized concerns over chemicals used in the grape fields and power plant. They have also wondered if there are any environmental concerns related to the massive power lines above the town. The residents feel that the women have experienced high numbers of miscarriages and that these factors must be related.
Okay, how would you know? What's the nurse's next step?
Environmental assessment.
Okay. What's one thing that you can do besides, we talked about windshield surveys, what else can you do?
We should get like a toxicologist involved and then look at the chemicals.
Good, good. But he's gonna have to have a really good reason for coming out to that area. You're gonna have to show a need.
Wouldn't you do a worksite survey, something like, I don't know,
Okay.
I mean, that could be, it's affecting the town, they say, but I mean, you would at least be able to check out the area first and how they're spraying it and everything else.
Okay, good. Yeah, fine.
You can also count the number of miscarriages and compare it to similar communities
Okay.
that don't have the power plants and the power lines, so
Very
see if
good.
there actually is a lot there increase.
So create a baseline. What else could you do too? So it's affecting women in a certain way. You might want to assess children of the community or the men. Even though they're, in the Great Hills, guess what, some of the kids are too, right? All right, so here's the question. Public health nurse has a responsibility to be informed about environmental health risks in the community. In what way is this competency demonstrated? Which of the 4 ways? What can she do? What would be important to do first? So you're gonna rule this one out, because you can't assume it, unless you know it for sure. Reassure community members,
I would roll that.
okay. Community health nurse is knowledgeable about the high-risk diseases of the population. That's important. But if she doesn't share that knowledge, it's no good, right? Nurse provides education. So, because nurses are so trusted, there you are. Environmental health risks rest with them. And this actually goes in chapter 6, I believe it is, the 10 principles, scope and standards, those 10 things that you can do to assess a community. And that's under the nursing scope and standards for environmental health. Okay, here's another question. Which of the following sciences would be able to study the poisonous effects of chemicals in the community? Got it, toxicology. Now, what's the difference between toxicology and epidemiology? Okay, this is more specific, having to do with the chemicals, right? And this is the association between the exposures and the population. And that's the one that you're concerned with, but in order to get that toxicologist out there, she's gonna have to say, well, this is what's happening, and this is what I see, and I did a windshield survey, and
I mean, like, wouldn't epidemiology also be more of where the source is and how it spreads rather than
yes.
what exactly the chemical is doing?
And what is that?
Epidemiology.
Yeah. Yes, very good, yeah, exactly, good application. Okay, so what are the ways in which a community health nurse would assess the environment, health risks of a population? Select all that apply. So the medium's kind of like their environment, the demographics, the setting, in like a rural versus urban, functional location, socioeconomic, okay? So what are the ways in which a community health nurse would assess the environment? What would she look at?
What's the difference between medium and setting? Those are both the
Okay. There you go, there's the answer. A medium is like, kind of what's around you, and it is part of the setting. But it's like the air and the water and all that. Locations is like the home, work, school, wherever you work. Demographics and socioeconomics, they're not going to be that important. But I know probably what you're thinking in terms of socioeconomic is if they don't have much money, then they're going to live in a, you know, more humble abode, so. Okay, so let's go on to, do you have any other questions about environment? Because I tell you what, there's just so much in it. We're gonna go to okay. We're gonna go to occupational nursing. So, did any of you guys in your experiences go out to the INL and follow the occupational nurse around there? Anybody do that? Some students did it last semester and they were amazed at all the things that that nurse did. I mean, she actually had a lot of responsibilities. So what would be one of the number one responsibilities at the INL that an occupational nurse would have? Okay.
Well, checking to make sure that the equipment is still functioning properly, like PPE is not torn off.
Good, yes, very good, yeah, exactly, in case there was a problem, an accident out there. Okay, and, you know, just in general, if there's any injuries, yeah, they do all those, and they assess all those, and maybe have to refer to a hospital or something. All right, so basically, our role in that area has been extended to include these things, not just the emergency treatment and prevention, but kind of like you were talking about with the PPEs and risk management. And I think, Evan, you were talking about doing a walkthrough. I mean, I think that's what you were talking about with the environment. And this is another thing that the environmental, that the occupational nurse would do. She would do a walkthrough for any particular problems if there was an area of concern. And everything is related to the bottom dollar, right? How can they improve something for less money? So here's the situation. Can I just have, yeah, thank you.
Arthur works as an occupational health nursing consultant at an on-site health and safety team for a string of warehouses for a large online supply company. Employees are timed in how fast they fill, pack, and ship orders, he says. Other members of Arthur's team include workers, reps, an ergonomist, an industrial hygienist, and a safety professional. Arthur also collaborates with an occupational physician who provides consultation and accepts referrals when medical intervention is needed.
Okay, so here's the situation. Randy, can you read that?
Jane Giles is an occupational health nurse working in a construction setting. Her role is to conduct screenings on newly hired employees and to ensure that physicals are kept up to date. Additionally, she is responsible for delivering emergent care in the event of an illness or injury. Prevention of injuries and accidents on a construction site depends upon employees who are free of alcohol and drug dependency. Employees are aware that the nurse may conduct screenings at any time.
So have you thought about that point? You know, making sure that not only physical injuries on the job, but an occupational nurse has to be looking at other things. Okay, kind of like a whole person. So she observes a construction worker acting more energetic and talkative than normal. And he's had several near misses, so, you know, that's a red flag. Related to safety, in the past week, he was observed to be entering the construction site without wearing his gear, which he never do. What would be causing this new behavior? What do you think? Okay, so you're thinking drugs right off. Okay, could it be anything else?
Mania.
Sorry?
Mania.
A mania of some kind, yeah? Anything else?
developmental learning, like it's just not understanding what he's supposed to be doing.
Okay, all right. So basically, what could be a suspected drug that would cause this behavior of these listed? Stimulant. Okay, so he actually approaches her and says that he's been taking prescription opioids, he's fearful of dependence, wants advice how to stop the medication, which is good for her, otherwise she was gonna have to approach him, right? Because she's seen a problem. So which of these would you choose should she do?
Question, are these questions related? Oh, so was he taking a stimulant in the last one, or he's?
Yeah, no, yes,
Now he's taking an opioid in this
that's what it says.
one.
I didn't make this up.
Okay.
So what do you think? So what should she tell him? Anybody? C. Okay, C, good. Yeah, because you guys know this, you know, you've gotta taper off, you can't just stop. All right, what's the main purpose of implementing a substance abuse program at a construction worker site? Kind of obvious, right? You remember what the harm reduction model was that we talked about? So basically, that's the answer though. D is the harm reduction. What does the harm reduction model say? Do you remember that? It's when we talked about ATOD, alcohol, tobacco, and other drugs. The harm reduction model is how we think of drug-dependent people now versus before they used to throw them in jail. Now, they think of them as someone that actually needs help and to treat them more as that, a person that needs some help versus them being a criminal and just throwing them in jail, because it's not gonna make any difference. Okay. So, you need to think in the epidemiological triangle, workers as a population, okay? And so they, in that triangle, would be the host. And here's some interesting facts. 60% in areas related to healthcare, fastest growing occupations. So what does that mean? What? You can get a job? Is that what you said? Well, in terms of an occupational nurse, what does that mean? It means that's probably who you might want to look at for some kinds of problems. Changing workforce, we have more women now, more older people, and people with chronic conditions. So you have to just take those things into consideration. So just a few things. 91% work outside the home for some portion of their lives. All right, so again, the host is all, the population is the individuals, the agent is whatever is affecting them, and the environment is their workplace conditions, and we're talking in terms of occupational nursing.
Can you go back there?
Oh, sure. Sure. Any comments? So I knew someone who actually had when he was a kid, he had asthma. As he grew up, he kind of grew out of it, so to speak. And he went to work, and all around him at work, people were smoking. And he just couldn't handle it. And he went to the office manager, they didn't have an occupational nurse, but they went to the office manager and, you know, they had told everybody, you know, you need to smoke outside, whatever. People still weren't doing that. And finally, they had to move him completely out of that room to a different room. So, yeah. So basically, you know, instead of making a policy about going out to smoke, what did this place do? They didn't do that. They wanted to accommodate everybody, I guess you could say. Can I go?
Yep.
Okay. All right, so primary levels of prevention. you know, of course, that you would want to teach them. Secondly, early diagnosis, prompt treatment, and thirdly, rehabilitation. And this is nursing care of working populations. So again, the nurse would look at their health history, look at their environment where they came from before using that I prepare, and then teach preventative measures. And then the work site walkthrough is very important. If something happens that had never happened before, this is what would be done. Okay. So which of the following actions that Arthur, we talked about earlier, has taken over in the last 6 months represents secondary prevention? Anybody? Okay. Hey, ready. Okay. All right. So we can skip this because of time, but he said that, accidents don't happen a lot, at least for me. I get a lot more chances to do secondary and tertiary prevention than I do primary, but thanks to better education, I think more companies are getting the message primary prevention saves having to do the rest. What's an example of a company that you know that is doing primary prevention? You don't have to tell me the name of the company, just tell me what they're doing. What are a lot of computer companies doing?
Increasing exercise or promoting exercise.
Good. Yeah, and how are they doing it?
I don't really know. I just know that a buddy of mine is in IT and that's what he's saying.
Okay.
Well, I have a friend that works at Melaleuca at like a call center, and they have their own like workout area that Melaleuca has provided for them.
Good, good. Yeah, Jamie.
My husband's work does incentives, so if you get a physical every year and you exercise and you get your blood drawn and you go to the dentist and you go to the eye doctor and do all that stuff, which they also pay for because it's preventative,
Right.
then they put $2,000 in your health savings account every year to help.
That's a big incentive. That's really, really big. Okay, so on campus here, a lot of employees have DMBA, and they too have that kind of incentive program, that if you walk so much, if you drink water instead of soda, if you, and just a few weeks ago, we had our blood drawn, and they check your cholesterol, and just all those, things. And they have an incentive for that, and it's year-round. I don't know if it's quarterly, I believe, that they have like a new incentive thrown out there. But we don't get $2,000. That's really good. That's really good. Okay. Anybody want to say anything else about 2000? Okay, yeah. Well, talk about computers too. I was going to add, there are a lot of companies that what they say is sitting is the new smoking. Okay? So true. So true. It takes like 10 years off your life if you're always sitting, doing computer stuff, whatever. So thus you have the workout areas. Thus you have these computer. Have you seen those? They have a computer and it has a little desk on it that you can raise up. And you can stand up and work. And then you can, lower it and sit back down and get up and down. And so that's all good too, isn't it? Okay. So for our last few minutes, interaction, let's see. Oh, I like this. I just wanted to read this. No one should have to sacrifice their life for their livelihood, because a nation built on the dignity of work must provide safe working conditions for its people. And here's two other websites, very, very important. You know of OSHA, right? Everybody knows OSHA. But then there's NIOSHA. And OSHA was actually originated in the 70s because I guess people kind of got a clue at work. It's like, well, we have all these injuries, what are we doing about it? And so OSHA came on board and said, okay, these are the guidelines. So thus that helps occupational nursing. And then NIOSHA is just the National Institute, kind of same thing, but it's part of the CDC. And they do research and then they give out, and this, very, very important. So just go to that website and it tells you an awful lot. This is okay. Let's see. Healthy People 2020, you guys know occupational safety and health objectives are in there. Just wanted to reiterate that. And then there's legislation going on right here. So workman's comp varies by state, just depends. And sometimes it varies by company too, because you can have the same company in several states, right? And then Mine Safety Act is an example. Okay. So real quickly, I'm gonna tell you what's most important about this last one here. Okay, so quality and safety. So quality and safety, you know, is important. So what is quality assurance? It's kind of sensible, isn't it? It's just supporting that the quality and safety are there. So tell me, from maybe a past clinical, what has the hospital done that you've noticed to promote quality assurance? Can you think of anything that was done at the time that you noticed?
They did, every shift, they did like a safety round, so everybody would meet together and they would share
Like what?
safety stories. You just meet together in one central location and then say, does anybody have a story? And they'd share things and then they'd talk about new things, like they just got these new caps to cover the central lines and then they had these cards that it was to check off for the central line dressings and everything. It was like an audit, I guess, to make sure that everybody was doing what they're supposed to be doing. So you filled that out each shift. And,
Really? They do? So is that on the computer?
no, it was actually a card that you take to your station and fill out, and then you bring it back. And if you did all of them, it's green, and if you missed one, it's red, so they can see how many you missed. And
so was there an incentive to do that?
I don't know. I'm sure there was, but
Probably.
because they're having lots of central line infections. So
Okay. Isn't it crazy? It used to be a lot of, catheterization, UTI type problems from leading catheters in. Now it's moved to central line. And
So this wasn't this semester, but last semester I remember doing a round in the ICU and they had the candy bar, or not candy bar, but ice cream bar thing, like little machine, because they had the most patient satisfaction. And which, I mean, like, it wasn't necessarily quality assurance, but I guess it correlates. Yeah, so they were pretty happy, and they were always going and getting ice cream bars. So.
Oh my gosh.
No, I see.
That's good. Anything, makes you feel good, your tummy, that's good.
one thing that I noticed, it's pretty simple, but the charge nurse and my nurse did like a narcotic check just to make sure that everything was still there, and if there wasn't there, I kind of asked him, what would you do if there's something not there? He's like, well, we'd go back to the nurses and make sure they're not like stealing drugs or something, because if they're stealing drugs, that's not safe.
Because that never happens, does it? Yeah.
When I was in the ICU at Remac, every shift the charge nurse would go in and he would just be walking around and be looking at patients, and he would be, or they, all of them, all the charge nurses did it, but they would make sure that the patients were being turned if they could be turned every 2 hours.
Yeah.
And they weren't, he'd be like, hey, I noticed your patient wasn't turned, or he would just go in himself and turn the patient if he could. And then he would also check their skin, check the charting to make sure every patient got a bath every single day. Yeah. So they were
What
really
is
big.
that?
Remac. So they're really big on skin integrity.
Yeah, that's a big thing, isn't it? Really big thing. Wow. Well, so as you know, and as you've experienced, some things are actually being done. Those are great incentives.
Hey, Joanne, go ahead.
Oh, I was just gonna say, I know this isn't just for the hospital I was at, but for labor delivery,
right when the baby's born, they put on like a security tag on the baby, and then like alarms will go off and you take the baby off the board.
Yeah,
They do that on these floors too.
yeah. Wow. So quality assurance. Okay, monitoring the activities of client care to determine the degree of excellence. So why do we care about excellence? Do they in Italy? Do they in Greece? Do they in Romania? Do they care about excellence? Have you ever been in a hospital that's not in the United States? Okay. Actually, honestly, we can really thank our lucky stars that we do care about excellence and continually improving. And you guys are key in being in that, managing quality assurance. Of course, as I said, bottom dollar is just right there, lower cost, so total quality management. This is a great website, okay? Write this down, because this is the Agency for Healthcare Research and Quality, and they are huge. .org is through the government, and they make sure, we don't have time to go to it right now, but you could spend hours just on that website. And if you ever need to go to have any kind of research for whatever, then anything, healthcare, it is really, really good. Let's see, that's the biggest item from this short presentation on this, is that website. So it's very important. Have you been to it before? I thought maybe in 490 you've been to it. But anyway, it's really good. So home health consumers utilize a website called Home Health Compare. And so you can compare, one home health agency against another. So when a patient is being discharged from a hospital, it is against the law to say, if a patient was to ask you, oh, I don't know any home health agencies, which one would you choose? Which one's the best? Which one should I go to? Against the law. You can't really tell them which one to go to. The hospital provides them a list of all the ones in the area. And, they can go to this website, Home Health Compare. Or if you're talking about hospitals, guess what? You can do the same thing and compare hospitals. How many stars? What are they better on or need to improve on? So that's out there on the net. Do the following on your next clinical day, and this was talking about the type of quality, the assurance that you're seeing that we just talked about. So I'm amazed that even in this area that we have all these things going. And I know that also back east when, for nurses, besides these things, I know that they require them to do research. Yeah, like if they're, climbing the ladder to the next step and they want to get a promotion, whatever, they have to do some kind of research or work on a research team of some kind. So the further west you get, it's not so much, talked about, but they do. Oops, let me see this last one. Oh, this is just general stuff. So, okay, we're done.
So can I share something really quick? I talked to a nurse that graduated from our program quite a while ago. I talked to her yesterday, and she shared something with me. It was something that happened in the hospital. And she learned a big lesson from it. And she said, boy, if I could help anybody else, this would be something that would help. And she was taking care of a patient that had an IV, and I think normal saline was dripping, and she had to hang a drip of a medication. And the normal saline, of course, was already in the pump, and she hung the other medicine and, went to hook it up to the IV, plug it into the IV without putting it into a channel of the pump, and unclamped it. So what happens when that happens? Bolus of medication of whatever was in that. So you think about it, if it was potassium, if it was, something that was going to affect blood pressure, any of those kind of things, they got a big, huge bolus. And anyway, luckily it affected the patient, and she started saying something like, I don't feel very good. And so she was able to, hurry and clamp it and realize what happened. But what happens with that is that you then do they call them incident reports? Still incident reports. And it's not to get her in trouble. I mean, things are going to happen in your careers. It's not to get her into trouble, but to get a committee looking at it and say, okay, how can this be prevented in the future? What can we put into place to make it so that this doesn't happen? Because it could kill a person depending on whatever the medication was. And, so what she learned from is she says, I will never, ever, ever, start working with something unless the lines are in the pump secured before I start to even hook them up to the patient and then unroll clamps. So some of this is just habits and things you need to get into into thinking that, okay, this is safe now. Now I can see how it hooks up to my patient.
So like Evan was talking about being in the intensive care area, Evan, how many lines do you have going into a patient and in an ICU? Usually a lot.
They have like, I don't know, 7 or 8 pumps.
Yeah, this is what I'm saying. You've got to get in the habit of following those lines. And then when you add something, making sure that is correct and doing that. And talking about incident reports, in the old days, they used to be punitive and people would lose their job. But nowadays they've done the research, they know it is not an individual problem, it's a system problem. And if this nurse is having this problem, guess what? This nurse over here could have that very same problem. So it's a systems problem and they need to fix it. So anyway, great question, guys. On the Talkstown, remember I sent out the instructions on the rubric. You can form your own groups. And for week 13, there's also a group assignment. You can keep the same groups if you want to. Those instructions are not up yet, but they will be in the next day or two. We've got Elsevier email, so just look at that, okay?